Prior to the operation, especially my left knee was just awful. Every step I took was a lot of pain. And when it started bothering me just sitting, then I knew I had to do something.
Go into it with the idea that I'm going to be so much better when it's over, and which everyone I've spoken to says that same thing, that they feel so much better, don't have the pain they had. So I got to the point even the first time that I felt I couldn't wait to go to the hospital. I had to wait a couple months actually before I could get the surgery, and that was the hardest part.
Hi, you want to know all you can about knee replacement, and we'll do our best to give you some of the vital information. To get answers to all your questions, explore the resources on this site and be sure to check with your doctor and other members of your healthcare team. They know you the best and can help you with your questions.
We should get you a good knee that lasts you a long time and you'll be comfortable in using it.
The information provided here is meant as an educational resource only and does not take the place of discussions with your healthcare professional. Ordinarily, we don't even think about how much the knees get used in walking, bending, and turning hundreds of times a day. When they're damaged or deteriorated, you may experience pain, difficulty walking, and your daily activities can severely be limited. Damage to these joints can be caused by osteoarthritis, rheumatoid arthritis, and injury. If you've decided to have or are scheduled to have knee replacement surgery, this site can provide you with useful information to help you prepare for the procedure. In addition, you should follow the instructions of your orthopedic surgeon and other healthcare professionals. The knee replacement may be referred to as a prosthesis. Knee replacement surgeries are among the most common procedures done in the United States. More than 660,000 knee replacements were done in 2008, and 95% last more than 10 years.
We can tell a patient that with an hour of surgery, you may have 20 years of enjoyable experience with that joint replacement for many, many years to come.
Most patients who have a knee replacement experience better mobility and range of motion, relief from pain, and a reduction in disability. Planning for surgery requires a lot of care and detail and may begin a month or two before the scheduled surgery. Let's look at the steps leading up to your hospital visit. You'll probably spend a month or two in planning, doctor's visits, tests, and other details to be sure you're ready for your surgery. Your hospital stay may be from 2 to 7 days. Your rehabilitation is usually 2 to 6 weeks, and after that, you should be able to return to normal activities within 3 to 9 weeks. Remember, these are general guidelines, and your recovery time may vary.
I was very confident because I did a lot of research. I went on the computer a lot, looked at a lot of surgeons. I talked to lots of people who had this operation. You have to ask questions because you're going to, it's a reasonably serious operation. You're going to give you a new knee, and you want to make certain that it's the right thing.
Before you undergo any operation, it is important that you and your doctor discuss the possible risks and complications of surgery and what signs and symptoms you should look out for. Refer to surgery risks in the Before You Enter the Hospital section of the website to review the possible risks and ways to help prevent them. Some risks to bring your attention to are possible anesthesia reactions and the potential for infection. One of the important things to guard against is the possibility of developing a blood clot. Blood clots form in the blood vessels and can cause damage by blocking blood flow.
We have newer drugs coming out that help us with the blood clotting problem so that we're able to thin the blood just right so that they won't get a blood clot in the leg and cause a pulmonary embolism. This is a very important part of how we help our patients be comfortable after surgery.
When a blood clot develops in the legs, it is known as a deep vein thrombosis, or DVT.
They let you know there's always that danger of blood clots. You know going in that there's a risk, but you have to weigh the consequences versus the results and have faith and have confidence in your doctors and nurses and so forth, and you do it. You just do it.
In some cases, a part of the blood clot breaks off, travels to the lungs, and blocks flow to this critical organ. This is a very serious condition called pulmonary embolism, or PE. Symptoms of DVT include swelling, discomfort, redness, or warmth in the affected area. Symptoms of PE include chest pain, shortness of breath, dizziness, and coughing up blood. There are ways to help minimize the risk of developing blood clots. Some of the measures are wearing compression stockings and taking medications as prescribed by your doctor. You will also learn how to safely begin moving and exercising to promote blood circulation and prevent blood clots. Now that you and your physician have decided on surgery, here are the key things to pay attention to. Be sure to keep all appointments with your primary care doctor and your surgeon. Their understanding of your health history is crucial to you getting the proper care you need and medications and keeping your risks low. Check with your insurance company to make sure that all pre-authorization forms are completed and that your insurance coverage is authorized for your procedure, medications, and follow-up care. If you have dental work that needs to be done, or just a routine checkup, take care of this before surgery to prevent germs in your mouth from entering the bloodstream and infecting the joint. If you are willing to donate blood, ask your surgeon if you should do so in case a transfusion is needed during your procedure. Pre-surgery tests will be taken in most cases. These might include blood and urine analysis, x-rays, scans, and an electrocardiogram. Be sure to fill your prescriptions before entering the hospital when possible. Also, if you're taking aspirin or other blood thinners such as Coumadin or Plavix, ask your doctor if and when you should discontinue them to reduce the risk of bleeding during your operation. If you're going to a skilled nursing or long-term care facility after your surgery, be sure to complete arrangements with them, including all medications that might be needed. Your surgeon may recommend that you consult with a physical therapist before your surgery. This person will be important in your recovery. Also, you want to be sure your home is set up properly for your return. Your furniture should be arranged so it's easy to get around. All the things you'll need to reach should be at or above waist level. Check for cords or rugs that you could trip on. Ask your doctor about items that will help you in the bath, and be sure you have enough food and toiletries on hand. Finally, wear comfortable clothes on your way to the hospital and pack more loose-fitting clothing so you'll be able to dress easily when you're discharged. Be sure to refer to this website as you go along for reminders of what we've discussed and for more helpful information. For additional information, see our next video during your hospital stay.